Okay, dear students, today I am talking about the cell injury. So first, what is a cell injury? Cell is a structural and functional units of the body. Cell injury. So why do you need to know this on cell injury? Whenever every disease is occurring in the human body, microscopically the cell become injured and the cell become unfunctional. So therefore we need to know on the concept of the cell injury. So what are the factors which causing the cell injury? There are the 5 factors which causing the cell injury. Number 1 is the physical factors. So in the physical factor, whenever there is increased temperature, so the cell become injured, and increased temperature is occurring in the burns injury. Whenever there is a decreased temperature in the sub-zero conditions, for example in the frost bite. So in the frostbite there is a decreased temperature and leading to the cell injury. Number 2, chemical factors. So the chemical factors, they are also causing the cell injury. For example, some drugs, some poisons, they are causing the cell injury. Number 3 is the infections. For example, the virus, bacteria, and fungi, they are causing the cell injury. And number 4, genetics. When the functions of the genes in the human body is altered, so it is causing the cell injury. So out of these all of, the most common cause of the cell injury is hypoxia. Whenever some person asking what is the most common cause of the cell injury, the cell injury most common cause is hypoxia. Hypo means decrease, oxia means oxygen, and it means decrease oxygen. Whenever there is decreased oxygen supply to the tissue, so the cell become injured. So now we are coming to the physiology of the hypoxia. Whenever we breathe oxygen, so this is our lungs. Whenever we breathe oxygen, so the oxygen are coming to the alveoli, and from the alveoli they diffuse to the blood vessels, and from the blood vessels it's carried to the cell. For example, it is a cell, so it is going to the cell through the blood. Whenever oxygen is coming to the alveoli, and from the partial pressure of the oxygen is diffused to the blood, and in the blood there is a hemoglobin. So the oxygen is bound with the hemoglobin, it making the oxyhemoglobin, and oxyhemoglobin is carried by the blood is carried by the blood to the cell, and when there is a normal cell, the oxygen is utilized by the cell. So this is the physiology of the oxygen and the blood, which is carrying by the blood to the cell and utilized by the cell. So there are the four processes. Number one process, when the partial pressure of the oxygen is sufficient, so it is diffused from the alveoli to the endothelial cells and then into the blood. So in the blood, if there is a sufficient amount of the hemoglobin and functional hemoglobin, so the oxygen is bound with the hemoglobin, so it makes the oxyhemoglobin. So this is process number one, which is required sufficient pressure of the oxygen, mean normal partial pressure of the oxygen. Number two process, there is the hemoglobin, which is a functional hemoglobin and normal amount of the hemoglobin, which bind with the oxygen and making oxyhemoglobin. This is process number two. And the process number three is there is a sufficient flow of the blood, which carrying the oxygen to the cells. And number four, here will be the normal cell which utilize the oxygens. If any of this process become altered, decreased, so the oxygen level will be decreased and leading to the cell injury. For example, number one, if the partial pressure of the oxygen is decreased, so the oxygen cannot diffuse to the cell and oxygen cannot making the blood oxygenate. So the oxygenation of the blood and the absence of the partial pressure of the oxygen, it's not taking place. So this kind of the hypoxia is called as hypoxic hypoxia. Hypoxic hypoxia mean the partial pressure of the oxygen is decreased and the oxygen are not able to oxygenate the blood. So this process is called hypoxic hypoxia. So this hypoxic hypoxia is occurring in the high altitudes, and certain disease of the lungs, for example the obstructive lung disease and pulmonary lung disease. Pulmonary lung disease like the obstructive lung disease. This is called hypoxic hypoxia. Number two, if the oxygen pressure is normal and partial pressure of the oxygen is normal, but there is a defects in the hemoglobin, if there is a decreased level of the hemoglobin, or if there is a normal level of the hemoglobin but it is an unfunctional, so this condition is called anemic hypoxia. Anemic hypoxia. Anemic hypoxia occur in the two conditions. Either if the hemoglobin level is decreased, so this is called anemia. Anemia. If the hemoglobin level is normal, but it is unfunctional, this condition is called non-functional hemoglobin, non-functional anemia. Non-functional, and the non-functional, it occurs in the condition like carbon monoxide. If the person is faced with the carbon monoxide, so carbon monoxide is bind with the hemoglobin and making the carbon oxyhemoglobin. So the carbon oxyhemoglobin, it's unable to take the oxygen to the cell. And the other, this is number one. This is the carbon monoxide. And number two, if there is a mid-hemoglobin means if there is a iron level become altered in the blood. For example, the normal iron level in the normal iron is Fe2. When it is converted to the Fe3, it means the ferrous is converted to the ferric form. The ferrous form is converted to the ferric form. So this is called methemoglobin, which is most commonly occurring in the pediatrics, and it is occurred by some drugs like the nitrofurantoin and sulfonamides, these drugs. So the methemoglobin is also unable to carry the oxygen to the lungs. And number three is called the stagnant hypoxia, if there is a not sufficient blood flow to carry the oxygen to the cell. So this condition is called stagnant hypoxia. Stagnant hypoxia. It means it is a sluggish movement of the blood which is unable to carry the oxygen to the cells. So this is called stagnant hypoxia. If it is occur in the arterial bloods, so it is called ischemia. If it is occur in the vein, it's called congestion. If it's occur in the arterial, it's called ischemia. If it's occur in the vein, it's called congestions. This is number 4. This is number 3. And number 4, if there is a sufficiency of the oxygens are carried by the blood, but it is not utilized by the cell. So this condition is called histotoxic hypoxia. So number 4, we are coming to review. Number 4 is histotoxic hypoxia. So histo means cell and toxic means toxicity. If there is a toxic to the cell, it is called histotoxic hypoxia. So the normal oxygen which is utilized by the cell in the presence of the cytochrome, this process is called oxidative phosphorylation. This process is called oxidative phosphorylation. If the cyanide poisoning are occurred to the cell, so it inhibits the cytochrome. It inhibits the cytochrome. So the oxidative phosphorylation is not taking place. So the cell become unable to utilize the sufficient amount of the oxygen. So now we are coming to the other topic, which is if someone are asking what is the most common cause of the cell injury, we are answering this most common cause of the cell injury is hypoxia. And what is the most common cause of the hypoxia is ischemia. Severity of the injury, severity of cell injury depends on the type of the cells. So there is the neuronal cells. Number 2 is there is the skeletal muscle cells, and number 2 is the heart, cardiac cell, and number 3 is the skeletal muscle, and number 4 is the fibroblast. So the most sensitive cell is the neuronal cells, which is become injured within the sequence. So the most sensitive cell is the neuronal cells, and the second one is the cardiac, which is damaging within the house, and the most resistant cell is the fibroblasts. So the most resistant cell is the fibroblast, and the most sensitive cell is neuronal cells. So you should learn these two. What is the most resistant cells and what is the most sensitive cells. So the injurious agents, talking about the injurious agents, when an injurious agent facing to the cell acutely and the cell become reverse to its normal function, so this process is called as adaptation means the cell become reverse to its normal function, so the cell become adapts. When the cell is facing the injurious agents chronically and the injurious agents are removed, so for example we remove the injurious agents, so the cell become reverse to its normal function, so this is called a reversible cell injury. Reversible cell injury. Whenever the cell become injured by the injurious agents chronically and we remove the injurious agents, but the cell are not coming, the cell is not coming to its normal function, and this is called irreversible cell injury. Irreversible cell injury and leading to the cell death. So this was the lecture about the cell injury. Thank you.